Sharam daram, shabdaram. Wow.
Oh guys, yes, para sa grade. Happy New Year! Muntik na kami magsabay-sabay. Yan! Go Pearl and Albanism. Diads kayo. Plus points. Go kuya. Jots. Banatan mo. Yes. Okay, Miss SOM.
A few moments later.
From the four corners of this country, we have flown them to the Gigahouse City, starting tonight and every night for the next 2 weeks. Join us from the Gigahouse City as we play Who Wants to Be a Millionaire? Pew, 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 pew. And for our contestant for tonight, the most enchanting and the ever-dazzling medical student of all time, may we all welcome, with a round of applause, Miss Angelica Kamayang! Pew, 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 pew.
So we start with number 1. Which of the following is true about edema? Which of the following is true about edema? A. Interstitial tissue can absorb up to 10 liters of fluid, accommodating up to 10% weight gain before peaking edema appears. B. Causes are rarely cardiac. C. Pulmonary hypertension frequently causes edema. And D. Dependent edema appears in the upper body
Okay,
parts.
my answer would be letter
So,
C.
the answer is letter C. So, to answer this question, we will base it on this paragraph which is lifted from Gates. So, sa letter A, the interstitial tissue can absorb up to 10 liters of fluid, accommodating up to 10% weight gain before peaking edema appears. So, according to Bates, the interstitial tissue can only absorb up to 5 liters of fluid to accommodate up to 10% weight gain before peaking edema. So, this simply suggests that letter A is not the correct answer. So, for letter B naman, causes are rarely cardiac. So, again, according to Bates, causes of swelling or edema are frequently cardiac. So, specifically right or left ventricular dysfunction and pulmonary hypertension. So, for letter B, dependent edema appears in the upper body parts. So, in here, according to Bates, dependent edema appears in the lowest body parts, and it appears in the feet and lower legs when sitting, or the sacrum when bedridden. So, we can also cancel out letter B. So, for letter C, pulmonary hypertension, this frequently causes edema. So, how? So, in this picture, you can see the heart. This is the heart. This is the lung. This is the lung. So, in here, you can see the left ventricle is colored gray, which indicates there is a dysfunctional left ventricle. So, when this left ventricle is dysfunctional, what the heart does is that it increases the contraction of the right ventricle to compensate the decreased function of the left ventricle. So, until such time na mapagod itong right ventricle natin, doon na mag-start yung problem. So, magkakaroon na tayo ng congestive heart failure or chronic heart failure. And in congestive heart failure, the contraction of the heart is weak. So, ang mangyayari ngayon, yung blood na napapump nila into your pulmonary arteries is nag-accumulate. So, the accumulation of blood in your pulmonary arteries causes an increase in your hydrostatic capillary pressure. So, anong bang ginagawa ng hydrostatic capillary pressure? Pag mataas ang ating hydrostatic capillary pressure, our plasma tends to go out to the interstitium of the lung, which then causes edema. So, balik tayo. So, pulmonary hypertension, this causes edema. So, when there is decrease in the contraction of the heart, magkakaroon tayo ng accumulation ng fluid, and this accumulation of fluid also increases the pressure of the pulmonary trunk. So, ito na yung pulmonary hypertension natin. And again, this pulmonary hypertension is due to the accumulation of liquid in your pulmonary arteries, causing now na nag-increase ang hydrostatic capillary pressure ng lungs natin. So, this increased hydrostatic capillary pressure sa lungs, it affects the capillaries, especially yung plasma levels natin. The plasma tends to go out in the interstitium of the lungs, causing now edema. So that would be all. Thank you.
So moving on to question number 2, stage 1 hypertension for greater than or equal to 80 to less than or equal to 60 years old is stage 1 hypertension for greater than or equal to 18 to less than or equal to 60 years old is letter A, 120 to 139 over 80 to 89 millimeters mercury. Letter B, 140 to 159 over 90 to 99 millimeters mercury. Letter C, 150 to 159 over 90 to 99 millimeters mercury. Or letter D, greater than or equal to 160 over greater than or equal to 100.
Okay, letter B.
You are correct. The answer is letter B. So, how did we get the answer? So, first, we must know the blood pressure classification for adults according to American Society for Hypertension, JNC-7. So, in here, they categorize the blood pressure reading for adults as normal, pre-hypertension, stage 1 hypertension, and stage 2 hypertension. So, it is considered normal if the systolic blood pressure reading is less than 120 millimeters mercury, while the diastolic blood pressure reading is less than 80 millimeters mercury. So, it is under pre-hypertension if the systolic blood pressure is between 120 to 139 millimeters mercury, and the diastolic blood pressure reading is between 80 to 89 millimeters mercury. But take note here that stage 1 hypertension is further classified into 2. So, for patients ages greater than or equal to 18 to less than 60 years old, or patients with diabetes or renal disease, it is considered stage 1 hypertension if the systolic blood pressure reading is between 140 to 159, while the diastolic blood pressure reading is 90 to 99 millimeters mercury. For ages greater than or equal to 60 years old, it is considered stage 1 hypertension if the systolic blood pressure reading is 150 to 159 and the diastolic blood pressure reading is 90 to 99. But take note that the American Society of Hypertension raises this cutoff to age greater than or equal to 80 years old. And lastly, it is considered stage 2 hypertension if the blood pressure reading is systolic is greater than or equal to 160 millimeters mercury, and the diastolic blood pressure reading is greater than or equal to 100 millimeters mercury. So our answer is letter B. So it falls under stage 1 hypertension. So additional info that according to ANC7 that patients with stage 1 and stage 2 hypertension should be treated.
So for the third question, the following are correctly paired except the following are correctly paired except A. At or near the lower left sternal border is the pulmonic valve. B. At and around the cardiac apex is the mitral valve. C. On the right second interspace to the apex is the aortic valve. D. On the left second and third interspace close to the sternum is the tricuspid valve. E. None of the above. F. Two of the above.
F, two of the above.
You are correct. The answer is letter F, two of the above. So two of them is incorrectly paired, which are the pulmonic valve and the tricuspid valve. So as you can see here on the picture, the pulmonic valve should be located on the left second and third interspace close to the sternum, while that of the tricuspid valve should be located at or near the lower left sternal border.
So for the fourth question, in the event of the cardiac cycle, diastole is the period of A. Ventricular contraction, B. Ventricular relaxation, C. Atrial contraction, or D. Atrial relaxation. I repeat the question. In the event of the cardiac cycle, diastole is the period of A. Ventricular contraction, B. Ventricular relaxation, C. Atrial contraction, or D. Atrial relaxation.
I go for letter B.
You are right. The answer is letter B, ventricular relaxation. So how do we get the answer? First, we must know the normal events in the cardiac cycle. The cardiac events occur from the beginning of one heartbeat to the beginning of next heartbeat is termed as a cardiac cycle. And a cardiac cycle comprises of a relaxation of the heart, which is the diastole, and contraction of both atria and the ventricles, which is termed as the systole. And usually, one cardiac cycle lasts approximately 0.8 seconds. So beginning with all the chambers in diastole, so meaning the heart is filled with the blood flows passively from the veins into the atria. For right atrium, there will be a venous return from the superior and inferior vena cava, while in the left atrium, it receives oxygenated blood from the pulmonary veins. After both atria receives blood, atrioventricular valves, your tricuspid and mitral valves, will open and blood will go into the right and left ventricles. Then after that, the ventricles will contract, raising the pressure within the ventricles. And when the ventricular pressure rises higher than the pressure in the atria, the blood flows towards the atria, closing now your AV valves, producing now the first heart sound, or which we call the S1 or the lub. Then as the pressure in the ventricle rises above the two major arteries, your pulmonary artery and your aorta, blood pushes open the two semilunar valves, your pulmonary and aortic valves. So when the blood now moves on to the pulmonary trunk and aorta in the ventricular ejection phase, after that, ventricular repolarization occurs. Then the ventricles begin now to relax. So this is now the answer to the question a while back, which is your ventricular relaxation, referring to your diastole. So this now explains that the pressure within the ventricle decreases. So as the ventricular pressure drops, there is a tendency for blood to flow back into the ventricles from the major arteries. So in order to prevent the backflow of blood, there will be a closure of two semilunar valves. And when this occurs, it will now produce the second heart sound, or the S2, the dub. When the AV valves and the When the AV valves pressure falls below that of the atria, blood moves from the atria into the ventricles, opening now your AV valves and marking now one complete heart cycle. So we must remember that the valves will prevent the backflow of blood. And in cases where there is a failure of the valves to operate properly, it could produce a turbulent blood flow within the heart, resulting to heart murmurs that can be often heard with a stethoscope.
For question number 5, in ECG waves, the following are correctly paired except in ECG waves, the following are correctly paired except
Letter D, P wave, atrial repolarization.
you are correct. Answer is letter D. ECG pacing starts about 40 milliseconds after SA node fires, and this begins with a P wave. The P wave represents atrial depolarization, and then followed by ventricular depolarization through the QRS. The QRS complex represents the electrical activity running first through the AV node, then through the interventricular septum, and then finally to the ventricles. S wave is a downward deflection following an R wave, while Q wave is the downward deflection from septal depolarization. This is quickly followed by the ST segment. The ST segment represents the end of ventricular contraction and the beginning of depolarization. And the whole thing ends with the T wave, which is the electrical reset of the heart and its preparation for the next cardiac cycle. Letter D is incorrectly paired because the T wave represents atrial depolarization and not atrial repolarization.
Next, number 6. Difficulty of breathing that occurs when the patient is supine and improves when the patient sits up. Again, difficulty of breathing that occurs when the patient is supine and improves when the patient sits up.
Letter C,
Your answer is correct. The answer is letter C. And we have the orthopnea. Actually, when you say orthopnea, this is having a shortness of breath that happens while a person is lying flat, and this occurs usually at night when a person is asleep. Actually, orthopnea is relieved by sitting up or elevation of head with a pillow. So when we say orthopnea, this is commonly seen in a late manifestation of heart failure, which results from fluid redistribution into the central circulation, causing an increase in pulmonary capillary pressure. So this is also seen in in the cases of abdominal obesity or pulmonary disease, and orthopnea is the opposite of platysmia. Because when we say platysmia, that is a shortness of breath that worsens when sitting up or standing up. So it is a different type. When we say orthopnea, it is when a person is lying flat, and when we say platysmia, this is about the shortness of breath when sitting up or standing up position. Now, we're done with discussing about the orthopnea, but how about the letter B? What it is all about? We have the orthostatic hypertension. Actually, the orthostatic hypertension is also called as the postural hypertension, in which That is a medical condition consisting of a sudden increase. There is a sudden increase in the blood pressure when the person stands up. And remember that this condition is associated with pheochromocytoma. Next one is, what is PNV? When you say PNV, that is what we call the paroxysmal nocturnal dyspnea. When we say paroxysmal nocturnal dyspnea, this is when a patient is suddenly waking up at night and with a severe attack of acute shortness of breath and cough. So when this happens, patient usually sit up on the side of the bed and walk around, and then they are attempt of finding a window to get some air. So that is what we call the paroxysmal nocturnal dyspnea. So remember, when it's about difficulty of breathing that occurs when the patient is supine and includes when the patient sits up, that's all about the orthopnea.
The following are categorized as high cardiovascular risk for women except letter A, existing CHD, letter B, CVD, letter C, subclinical arteriosclerosis, letter D.
Letter C.
You are correct. The answer is C. Let's all remember that cardiovascular disease is still the leading cause of death for women as well as for men. All of the questions are considered as cardiovascular risks for women. However, under the American Heart Association cardiovascular risk categories for women, subclinical arteriosclerosis does not fall under the high risk category. But women presenting evidence of advanced subclinical arteriosclerosis are considered at risk for heart disease.
Number 8. Lifestyle modifications to prevent or manage hypertension. Lifestyle modifications to prevent or manage hypertension. A. Regular aerobic exercise such as brisk walking 3 to 4 times a week, averaging 40 minutes per session. B. Moderate alcohol consumption per day of less than or equal to 2 drinks for men and less than or equal to 1 drink for women. C. Optimal weight or BMI of 18.5 to 24.9. D. Intake of less than 6 grams of sodium chloride or 2.3 grams of sodium per day. E. All of the above. F. All except 1.
Letter E.
You are correct. The answer is letter E. All of the above. According to the 7th report of the Joint National Committee on Prevention, Detection, Evaluation, and Treatment of High Blood Pressure, lifestyle modifications should be employed as first-line therapy to prevent and manage high blood pressure. The major lifestyle changes that have been shown to lower blood pressure is to first, engage in regular aerobic physical activity like brisk walking for greater than or equal to 30 minutes per day. Increased body weight has been shown to have a significant effect on raising blood pressure. Therefore, weight loss in overweight and obese individual is an important and effective strategy. Adoption of the DOSH or the dietary approaches to stop hypertension eating plan is also recommended. Dietary sodium restriction, smoking cessation, stress reduction have been shown to reduce blood pressure. Practicing multiple lifestyle modifications simultaneously can have an additive effect on lowering blood pressure.
In assessing the carotid pulse, all of the following must be done except in assessing the carotid pulse, all of the following must be done except A. Palpate both carotid arteries at the same time to ensure accuracy. B. Press just inside the medial border of a relaxed SCM muscle. C. Avoid pressing on the carotid sinus. And D. Slowly increase the pressure until you feel a maximal pulsation.
Letter A.
Your answer is correct. The answer is letter A. Palpate both carotid arteries at the same time to ensure accuracy. So in here, although pulses can be taken simultaneously to assess equality, the carotid pulses are never taken at the same time. We gently palpate one artery at a time so that we do not stimulate the vagus nerve and compromise arterial blood flow to the brain.
So for the question number 10, in this condition, the rhythm of the pulse remains regular. The course of the arterial pulse alternates because of irregular strong and weak ventricular contractions.
Letter B.
You have the correct answer, and that is pulsus alternans. As you can see from the question, there is already the clue, and that is the word alternates or alternans. So in pulsus alternans, there is alternating strong and weak beats. It is almost always indicative of left ventricular dysfunction. So in left ventricular dysfunction, the ejection fraction will decrease significantly, causing reduction in stroke volume. This reduction of stroke volume will cause the increase of end diastolic volume. As a result, during the next cycle of systolic phase, the myocardial muscle will be stretched more than usual, and as a result, there will be an increase in myocardial contraction. This results in turn in strong systolic pulse. There may be initially a tachycardia as a compensatory mechanism to maintain the cardiac output. So, when the cuff pressure is slowly released, phase 1, the carotid sounds are initially heard only during alternate strong beats. With further release of the cuff pressure, softer sounds of weak beats also appear.
Question number 11. A murmur-like sound arising from turbulent arterial blood flow is. A murmur-like sound arising from turbulent arterial blood flow is A. Thrill, B. Bruce, C. Gibson murmur, D. Machinery-like murmur.
B.
You are correct. The answer is B. Bruce. It is heard when you auscultate using the diaphragm of the stethoscope, while trill is a buzzing or vibratory sensation caused by underlying turbulent flow and detected in palpation. And Gibson murmur is also called the machinery-like murmur. It is a long, rumbling sound occupying most of systole and diastole, usually localized in the second left interspace near the sternum, and usually indicative of patent ductus arteriosus.
For number 12, palpate impulses from the right ventricle in the right ventricular area, normally at the letter A, lower right sternal border, letter B, upper left sternal border, letter C, mid-sternal level right, letter D, subxiphoid area.
I go for D.
You are correct. The answer is letter D. According to Bates, palpate impulses from the right ventricle in the right ventricular area at the lower left sternal border and in the subxiphoid area. As you can see on the picture on the right, you can see the outline of the right ventricle. You can also palpate your right ventricle normally in the lower left sternal border and in the subxiphoid area. So letter A is wrong because we usually palpate your right ventricle on the lower left sternal border. The letter B is incorrect because we palpate normally the right ventricle in the lower left, not the upper. Letter C is wrong because we can palpate only the right ventricle normally on the left side of the chest. And letter D is the correct answer.
So next, which of the following is true about the apical impulse? Again, which of the following is true about the apical impulse? A. Represents the brief early pulsation of the right ventricle as it moves anteriorly during contraction and contacts the chest wall. Letter B. In most examinations, the apical impulse is the PMI. Letter C. The apex beat is palpable in 6% of adults in the supine position. And letter D. Aortic aneurysm will not produce a pulsation that is more prominent than the apex beat. So, which of the following is true about the apical impulse? What do you think is the answer?
I go for letter B as in boy.
You're right. The answer is letter B. In most examinations, the apical impulse is the PMI. So, let's try to explain what makes the other statements not true. First, letter A. So, this is incorrect because it's not the pulsations of the right ventricle that is represented, but rather the left ventricle, as we can see on the picture on our right. Therefore, the right statement then is the apical impulse represents the brief early pulsation of the left ventricle as it moves anteriorly during contraction and touches or contacts the chest wall. Next, letter C. The apex beat is palpable in 60% of adults in the supine position. This is also not true because only about 40% of persons in the supine position will show a palpable apex beat. So, as a review, again, if you cannot identify the apical impulse with the patient supine, ask the patient to roll partly onto their left side. So this is now what we call the left lateral decubitus position. Then we palpate again using the palmar surfaces of several fingers. And again, if you cannot find the apical impulse, we then ask the patient to exhale fully and stop breathing for a few seconds. And lastly, letter D. This statement is also not correct since, if you can remember, some pathologic conditions may produce a pulsation that is more prominent than the apex beat, right? So, to give an example of these conditions, we have an enlarged right ventricle, a dilated pulmonary artery, or an aortic aneurysm. So yes, aortic aneurysm will produce a pulsation that is more prominent than the apex beat. So again, the answer is letter B. In most examinations, the apical impulse is the PMI or the point of maximal impulse. Congratulations!
Question 14. The best patient position to assess mitral stenosis is A. Supine position, B. Left lateral decubitus position, C. Dorsal recumbent position, D. Orthopnic position. Again, the best patient position to assess mitral stenosis is
B as in boy.
You are correct. The answer is B. As you can see in this picture, the patient is lying on his left side, allowing the left ventricle to move closer to the chest wall. Also, this position accentuates left-sided S3 and S4 abnormalities as well as mitral murmurs.
For your last question, chest pain is one of the most serious of all patient complaints. The medical student knows that all of the following are correct about chest pain except letter A. Classic exertional pain, pressure, or discomfort in the chest, shoulder, back, neck or arm in angina pectoris is seen in 18% of patients with acute AMI. Acute coronary syndrome is increasingly used to describe the clinical syndromes caused by acute myocardial ischemia. Letter C. Anterior chest pain, often tearing or ripping and radiating into the back or neck, occurs in acute aortic dissection. Letter D. If there are symptoms or signs of irregular heart action, obtain an ECG. Letter E. None of the above. Or letter F. Two of the above. Again, chest pain is one of the most serious of all patient complaints. The medical student knows that all of the following are correct about chest pain except
I go for E, none of the above.
you are correct. All of this information are true regarding chest pain.
Is that your final answer?
Yeah naman. Duh, I studied well.
Miss
Char.
Kamayang, you have won $1 million!
Oh my gosh, Jods. Oh my gosh. Huwag ka ma-feeling dyan. Alam ko may cut ka dito. Iyak-iyak ka pa dyan. Feeling.